Hey guys, welcome back to another Ask We World podcast episode. So grateful to have you all here. I'm kind of excited today because I have a very special guest and I'm honored to have Dr. Thomas Brown with me today. I actually did a video where I reviewed his awesome book, which is the ADHD and Asperger syndrome in smart kids and adults. I actually did a full book review of this book. So if you want to check that out, I will leave a link for that somewhere in the description of this video or in the show notes of the podcast. Well, Dr. Brown, welcome to the show.
Thanks, Daniel. I'm delighted. I appreciate your book review of my book, and I'm delighted to be on this program with you.
Oh, absolutely. It was my honor. It was my honor, honestly. You have so much cred, within the community. It was really cool to have that opportunity. So I thank you. The pleasure was there. So for anybody who doesn't know, would you be able to kind of just introduce yourself and tell us a little bit about what you do?
Sure. My name is Tom Brown, and I'm a clinical psychologist. I earned my PhD at Yale University, and then in clinical psychology. And then I was invited to join the faculty there. So I served on the clinical faculty of Yale Medical School in the psychiatry department for about 20 years, while I was also operating a clinic for children and teenagers and adults who had ADHD, and did both of those things for a little bit past 20 years. And then my wife died, and I decided I was going to make a move because I have two grown kids and two grandkids, all of whom lived in Los Angeles while I was living on the East Coast. And so I resigned from Yale and closed my clinic there, moved out to Los Angeles, where I now live within a very short distance from my kids and my grandkids. And I opened a new clinic here in Los Angeles, in Manhattan Beach, actually, the suburb, where I see particularly high IQ children, teenagers, and adults who have ADHD, and most of whom also have something else in the package. Because ADHD very rarely, incidentally, you'll hear me say sometimes ADD, sometimes ADHD. I mean the same thing with both terms. But many of the people I see have not just ADHD, but ADHD often comes with anxiety or with depression or with obsessive compulsive disorder or with other difficulties that you need to pay attention to. And so I enjoy my work. I'm also a clinical professor at one of the 6 medical schools for the University of California, where I do some teaching. Wow. And enjoy not only the nice weather we're having in California, but also a chance to see patients of all different ages who are struggling with ADHD. And some of those people are in the neighborhood here in Los Angeles, and many of them are from other parts of the United States. And I also see a number of patients who come in from other parts of the world. Wow. They're in person or sometimes on Zoom sessions.
Yeah, well, like next time I'm in LA, I will definitely hit you up because I'm in LA quite often. Well, when there isn't COVID restrictions, and all this craziness going on.
But yeah. I'll be glad to take you to dinner and spend some time with you.
Oh, 100%. Yeah, definitely. Yeah, me and my team, usually every year we fly out, we do VidCon, we do a bunch of other kind of like events and stuff all around kind of like June or July time. So I'll hit you up. Definitely. But that sounds really interesting. But one of the things I really want to home in on is you mentioned high IQ, right? And this is something I get a lot of flack for because when I talk about high IQ and people on the spectrum, especially people who are diagnosed with Asperger syndrome like myself, people kind of get a little bit offended by it, I think, or they, and they kind of, they look as if to say, well, you're only saying that people with Asperger syndrome can have a high IQ, which isn't correct. I never said that, but people do kind of get offended by that. But in terms of, you study and work with a lot of people who have high IQs. What would you say the relationship between having high IQ and a spectrum condition is? Do they come hand in hand? I mean, what's the typical ratio?
By definition, the diagnostic manual, when it did have the Asperger's diagnosis, and they, I think, unwisely took it out to make it just a part of the autism spectrum some years ago. But by definition, Asperger's syndrome was having at least average, if not above average, IQ. And it doesn't mean that everybody who is in my practice or who has this a problem, has high IQ. But the reason I got interested in it is not just because of people who have Asperger's, but also there are a lot of people who have high IQ who have ADHD and are not recognized as having it.
Okay.
And that's a problem.
Yeah.
Because many of these people, for example, many of the people I see have done very well in elementary school, and their schooling then gets a little more problematic. People see them as wonderfully smart and really interesting, and then as they get into, and often get good grades, but then as they get into the middle school, high school years, many of them begin to have a lot of struggle in keeping up with their work and being able to get things done. And people then say, well, look, you are so successful, you should be able to do this.
Yeah.
And you're just being lazy. And it makes it pretty hard for them as a result of that. And it's complicated by one other fact about ADHD. So I guess one of the things I'd say is that I think that there are special pressures on people who have ADHD and are smart, are very high IQ folks. And that is that the expectations that they and their parents and their teachers have for them, and their expectations of themselves, are for high levels of achievement, and often they're not able to do that very successfully. I think that's a reason why they need a little extra help in getting an assessment and treatment. But let me mention one other thing that I think is true, not just for the high IQ folks, but for everybody with ADHD. And it's what I speak about and have written about as the central mystery of ADHD. And that's a phrase I use to talk about something that's quite puzzling that I often see in my work. I've seen many, many children, teenagers, and adults with ADHD over many years of practice. Every single one of them has a few specific activities where they have no difficulty in exercising those same executive functions that are for them very problematic in almost everything else they do. It's different. Let me give you an example. I had a 16-year-old boy who was brought into my office by his parents, and he was the goaltender for his school's ice hockey team. And it just happened that the team had won the state championship in ice hockey the day before. And so as they began the conversation with me, the parents were bragging about how great he was because he was the goalie.
Yeah.
And apparently he was an extraordinarily good goalie. They said when he's in net playing hockey, he missed nothing. He knew where that puck was every second of a fast game, totally on top of it, the kind of goalie every team wants. Smart kid, tested way high up in the superior range, wanted to get good grades, was hoping to go to medical school, but he was always in trouble with his teachers. And what they'd say to him is, once in a while, you'll say something that shows how smart you are. We'll be talking about something, you'll come in with some comment that's really very perceptive and it's impressive. But most of the time you're out to lunch, you're looking out the window, you're staring at the ceiling, you look like you're half asleep. Half the time you don't even know what page we're on. And the question they kept asking him was, if you can pay attention so well when you're playing hockey, how come you can't pay attention sitting in class? Or here's another example. A lot of times parents will bring in little kids for me to see, and they say, well, the teacher says this kid can't pay attention for more than 5 minutes. We know that's not true. We've watched him play video games, and he can sit and play those video games for 3 hours at a time and not move. Teacher said he's easily distracted. That's nonsense. When he's playing those games, he is locked on that screen like a laser. And the only way you're going to get his attention is to jump in his face or turn off the TV. So again, so I can do it here. Why can't you do it there? Now, it's not always sports or video games. There are some people with AD, they're not good at that. That might be into art, and they're sketching and drawing and really getting into it for hours at a time. Somebody else, when they're little, they're creating engineering marvels with Lego blocks. And then when they're older, they're taking car engines apart and putting them back together, or designing computer networks. But everybody I've ever seen who's ADD has a few things like that, where they have no trouble paying attention, no trouble using short-term memory, no trouble organizing things, no trouble sustaining effort to work on things. even though they've had a lot of trouble with those things and almost everything else they do.
That's
Ask them
fascinating.
about it, and you say, "What's with this? How come you do it here and you can't do it here, here, and here?" Usually, what they'll say is, "It's easy. If it's something I'm interested in, I can pay attention. If not, I can't." And most people hear that and say, "Yeah, congratulations. That's true for anybody. Anybody can pay attention better for something they're interested in than for something they're not interested in," which is true. But here's the difference. People who don't have ADD, if they've got something they've got to do and they know they've got to do it and it's important, they can usually make themselves pay attention, even if it's pretty boring, just because they know they got to do it. People with ADD, it is incredibly difficult for them to be able to make themselves pay attention unless the task is something that's really interesting to them, not because somebody said, "Hey, you should get interested in this because it's going to get you a better grade or a better job review," but just because it is interesting to them for whatever reasons.
Yeah.
Or if they feel they have a gun to their head and that something they do not want to see happen is going to happen fast if they don't take care of this right here, right now. Under those two conditions, it changes the chemistry of the brain instantly. And the problem is it's not under voluntary control. And so it looks as though you can do it here, why can't you do it there? When in fact, that's the nature of the problem. I had one college student years ago who said to me, "I have a sexual example for you for what it's like to have ADD."
Sure.
He said, "Having ADD is like having erectile dysfunction of the mind. If the task you're trying to do is something that turns you on, you're up for it and you can perform.
Yeah.
But if the task you're trying to do is not something that's intrinsically interesting, if it doesn't turn you on, you can't get it up. And if you can't get it up, you're not going to be able to perform it." In that situation, doesn't matter how much you may say to yourself, "I need to, I ought to, I should." You can't make it happen. It's simply not a willpower kind of thing.
That's a really interesting example because I suppose that would play onto kind of like the crossover with drugs. People who have issues performing with sexual activity can use drugs to improve those performances. And I guess people with ADHD, we do get offered medication a lot of the time, right, to perform. And I think there's a big debate about that. Like some people they call it like med shaming or whatever. What's your take on medication and ADHD? What do you feel about it?
Well, what I can tell you is if you want to find out different ways of trying to cope with ADHD, you can go online and you'll find long lists of computer programs that claim they can help you to improve your brain, and lists of specialized diets they think you can take and exercise programs. But the fact is there's not any solid scientific evidence to support any of those things as being really helpful for alleviating the problems of ADHD. Because essentially this is a disorder, ADHD, what we call this cluster of symptoms that we call ADHD, or is something which is really a problem with the dynamics of the chemistry of the brain. And, the most effective treatment we've got, and we've got a lot of evidence to support its usefulness, is a few limited types of medicines, basically stimulant medicines, most of them, that help to change the brain's chemistry. The medicines we have for ADD cure nothing. It's not like you have a strep throat, you take an antibiotic and it knocks out the infection.
Yeah.
It's more like my eyeglasses. I have a problem with my eyes. I can't read typewriter size print without my glasses. If I put these on, I read it as well as anybody can. Take them off, I'm right back where I started. The glasses don't fix my eyes. They just help me see when I've got them on.
Right.
And in the same way, the medicines that we have for ADHD don't cure the ADHD symptoms, but during the hours that medicine is active, if the person has an appropriate dose for them, it can help to alleviate the ADHD difficulties during the time the medicine's working. And then when the medicine wears off, sometime before the end of the day, they're right back to where they started. And for some people, it's huge how much it helps them. For others, it's substantial, but it's not huge. Others, it helps a little, but not that much. And 2 out of 10, it doesn't do a damn thing. I usually tell people your chances of medicine helping you for ADHD are 8 out of 10. For some people, it just does not work. But the main problem is many physicians, and including psychiatrists, don't get much training in how to use these medicines that we have for ADHD, and don't know that the appropriate dose for somebody of a stimulant medicine for treating ADHD doesn't go by how old you are or how much you weigh or how severe your symptoms are. It goes by how sensitive is your body chemistry to that specific medicine.
Oh, it makes sense. Yeah.
And there are many medicines you can prescribe according to how old the person is, certain age or certain weight.
Wait,
This is
yeah.
the right dose. But with these medicines, that's not how it works. In my practice, we have some people who, little first and second grade kids. Most of them are taking very small doses, but there are a few of them, not many, where we've got to go almost to the adult dosing range to touch them because their bodies are not that sensitive to this particular medicine.
Mm-hmm.
On the other end of the spectrum, they have, I've got a lot of adults I see, including some people who are, a few people who are like 6'2", weighing 280 pounds, who function best on a dose which is not much bigger than we give a first or second grade kid. So it's a matter of how sensitive your body chemistry is to this medication. And it's that fine tuning, getting the dose adjusted. And it often requires, usually what we do is start people with a baby-sized dose and then just stair step it up because we're looking for that sweet spot between too little and too much.
Right.
If you have too little, it doesn't do a damn thing. You might just as well be taking breath mints.
Yeah.
But if you have too much, then one of three things: you can get jittery, like you've had way too many cups of coffee, or you get really irritable, where every little thing is pissing you off way more than it would normally, or you get too serious, where you sort of get this blunted emotion. You don't feel much like talking to people. You may be able to focus, but you sort of you lose out on a lot of your personality.
I had that when I first had meds.
I'm sorry?
I had that experience when I first went on my medication.
Yeah.
I had that exact, my girlfriend was like, dude, are you okay? Because I was like,
well, yeah, that's exactly the way people respond to it. And the problem is one that can be easily fixed. It happens typically, first of all, you got to get the dose right so that it's not too much or too little. But the other thing is that sometimes that happens with a person who may be on the right dose, but then the medicine wears off. Most of the medicines we use now are designed so that you can, they sort of go along and then gradually taper down.
Okay.
But at least the longer acting ones do. However, there's some people for whom it doesn't work that way. And the medicine's going along, and then it's not like tapering down like a nice exit ramp on a freeway. It's like falling off a cliff.
Yeah.
And the way that happens is that there are three things that you look for. One is the person getting jittery, like they've had too many cups of coffee. The other is they're getting really crabby, or the third thing is getting too serious again. The same thing that happens if the medicine dose is wrong.
Sure. And
it's easy to fix. Usually, if that's the case, all you need to do is use a small dose of the short-acting version of the medicine so that you can build a more smooth exit ramp from the freeway.
Yeah, it makes perfect sense, right? So it's really interesting and fascinating, really. So I have a question. What do you feel about the relationship between autism and ADHD, right? Because I have a diagnosis of both, and they came comorbidly within the same kind of assessment. And a lot of people always ask me, like, why are people on the autism spectrum also, why do they always also have ADHD and vice versa? And I'm like, I don't really know the right answer for this. I just know that it happens.
Okay, well, we know that both problems are inherited, highly heritable.
Right.
And there's a lot of controversy about this in terms of the genetic research, but the simple fact is it runs in families. Autism runs in families. ADHD runs in families. Out of every 4 people diagnosed with ADD, one of them has a mom or dad who's got it, whether they know or not. The other 3, if they don't have a parent who has it, usually there's a grandparent, an uncle, an aunt, a cousin, or a brother or sister.
Yeah.
Once you get to know what ADD looks like, you can often look at the family tree and say, oh, yeah, that uncle was always a little quirky.
Yeah.
And then this grandmother had some difficulties. And there actually are a number of studies where they've compared samples of identical twins who did and didn't have ADHD. And there's something called a heritability index, which is used to report the level of correlation between people who are identical twins and non-identical twins. And that scale runs from 0 up to 1.
Okay.
And the way it works is If it's 0, what it's telling you is genes don't have much to do with it. If it's 1, it means genes mostly explain it.
Right.
And on that scale, breast cancer is about a 0.3, asthma is about 0.5, height is 0.9, and ADD is 0.76.
Sheesh.
Which is really up there.
Yeah.
And I don't have the numbers on autism heritability in my head at the moment, and there's a lot of controversy about who you put in which category there.
Sure.
But I know that autism does run in families, and it certainly does not, just like ADHD, it doesn't hit everybody in a specific generation. And there are some quirky things about the genetics of it that are subject of interesting and active research right now. But both of these things run in families, and then it just happens that some family you've got both things coming in from the same
both sides. Like, I get you. Yeah, that makes sense. Yeah, because there's I have quite a few family members who have similar diagnosis.
Well,
so
yeah, and the fact is that regardless of what the causes are, most of the decent studies on correlations between autism spectrum and ADHD indicate that the likelihood of somebody having both is someplace around between 60 and 85%.
Wow, that's interesting.
It's highly heritable. And the thing that's unfortunate about it is that often one or the other is not recognized.
Yes.
There was a study done at Harvard University's medical school a few years back, and they had a sample of 140 kids that had been referred to their autism spectrum unit for evaluation and treatment. And when they very carefully evaluated all of them to see if they had diagnostic criteria for ADHD, in addition to their having been diagnosed already carefully with autism spectrum. And what they found was that of those 140 kids they had, 70% of them also had ADHD.
Wow.
And of the 70 kids who had ADHD, in addition to autism, the bulk of them were not actually, had never been diagnosed with the ADHD.
Yes.
Because what happens often in medicine is a person who does an evaluation notices one problem, which is a substantial problem. You've got a lot of evidence for it. And often at that point, they stop looking.
Yeah.
And don't look far enough to see there may be something else hiding behind the bushes, as it were.
Yeah. And this happens a lot, right? And I hear this a lot from people who I know are diagnosed with one thing, and they might have ADHD or an autism diagnosis, and then like a couple of years later, going through different types of therapies and seeing different doctors, then they all of a sudden say, well, hey, I have this comorbid condition of the other one as well, and they didn't know. And it's
but often people will pick up one and not the other.
Yeah, it just depends whether
the symptoms are more obvious or because other people in the family have a similar problem.
Yep.
But the other thing is that a lot of psychologists and psychiatrists and even regular physicians don't have much training in how to recognize ADHD. They're still operating on a notion. ADHD was first recognized in the English medical literature in 1902.
Wow.
But from 1902 till 1980, it was all about little boys who couldn't sit still, wouldn't shut up, and were driving everybody nuts.
Yeah.
It was behavior problems.
Yeah.
It wasn't until 1980 that they added the term attention deficit to describe the disorder. And even then, for a long time, it was just attention deficit with hyperactivity.
Yes. And
now we've gradually built up a pile of evidence to support the notion that ADHD really involves, it's basically the management system of the brain. And it's a complicated thing, which includes being able to get organized and get started on stuff.
Yeah.
Being able to focus and then shift focus when you need to. Being able to regulate alertness so you can be asleep when you need to be asleep and awake when you need to be awake.
Oh, man.
Being able to sustain effort, where one kid, a high school kid on a track team, he said you know, my mind is a great sprinter, but it's a lousy distance runner. And he was using that to talk about how if whatever he was faced with doing, he could do it quickly in one chunk. You go all out for it, and then you're done with it. He said, I'm fine. But if it's something, he said, where you have to keep chipping away at it day after day, he said, that I have a lot more trouble with. And many people with ADD are that way.
Yeah, yeah.
And then managing emotions. And the official diagnostic criteria say nothing about emotion as part of ADHD, but the fact is emotions play a huge part in ADHD.
Of course.
And in motivation. Yeah. And then memory. Ask people who have ADD, how's your memory? Often they say, oh, I've got the best memory in my family. I can remember stuff nobody else can remember. To give you some example about some movie they saw 15 years ago. Mm-hmm. They've seen it once and they tell you every detail, the entire storyline of the movie. Mm-hmm. But they can't tell you what happened just a minute ago.
Yeah, I have the exact issue.
With memory for most people with ADD is primarily short-term working memories, being able to remember what it is that you're coming to get in when you walk into the room, instead of standing there scratching your head and what the hell you came in here for.
That was the first diagnosis I had, was a short-term memory issue, like straight away.
Yeah. Well, and that's exactly the issue that a lot of people struggle with.
Yeah, yeah. Dude, this is all really super fascinating, but we have to wrap it up, obviously, because, you know, people, my listeners only have a few minutes in the day to get their episodes in. So if anybody wants to learn more about you, your work, and all the cool things you're doing, how can they find you online? What's the best way?
The best way to find me online is on a website. And you just look at www.brownadhdclinic.com.
Perfect. I will leave that also in the show notes and the description of this episode, so people can click through directly. But if you aren't obviously able to write it down, just check back on this episode, and it should be in the show notes and the description. Dr. Brown, thank you so much for being on the show. This has been absolutely fascinating.
It's a privilege for me to be here.
Oh, the privilege is mine. Thank you so much. Okay, take it easy, and we'll see you next time.